Welcome to the NHS Employers 2013 Summit. The past 12 months have been the most challenging and significant in the NHS. We have faced massive reorganisation, pay freezes, industrial action, pension increases, and most importantly, the report into the failings at Mid Staffordshire Trust with lessons for all parts of the NHS system and those that work in it. Our team at NHS Employers has been dedicated to supporting and representing you on workforce issues every step of the way. Here is a look back at the work we have been doing over the past year and our priorities for the year ahead.
My team represent employers in relation to education and training, workforce planning, medical regulation and pain conditions of employed doctors and dentists. Last year we represented employers' views in the business case for the implementation of medical revalidation. We published guidance on job planning for SAS doctors and advice on using early intervention to help doctors stay on course with their careers. The team completed exploratory talks with the BMA to reach heads of terms for potential agreement on reformed pay and conditions for junior doctors and for consultants, and began negotiations which will continue over the next year.
Over the past year, we have provided strategic and practical support to help trusts increase apprenticeship opportunities and meet the government's apprenticeship targets. Our team also delivered a webinar and published good practice examples to emphasise the benefits of trusts working in partnership with Job Centre Plus. Going forwards, we will work with key partners to produce coherent plans for strategy development and cross-government working. We continue to help the NHS develop local strategies to increase partnership working with Job Centre Plus.
We work with trusts and NHS chief executives to drive a permissive use of social media in the NHS. We encourage a cultural shift in the use of technology in the NHS to promote transparency. Join the conversation using the hashtag NHSEngage.
We have provided support and visited 102 trusts to review their health and wellbeing approach, which has included reviewing and supporting their plans to reduce sickness absence, implementing health and wellbeing initiatives and developing improvement plans. We have created an online sickness absence calculator that calculates the time and money organisations can save by reducing absence. We've published a range of guidance, including rapid access to treatment and rehabilitation for NHS staff, managers' guides on implementing health and wellbeing, and prevention and management of sickness absence. We have developed tools to help organisations see the link between staff health and wellbeing, patient experience, and organisational performance.
I work to deliver a programme of communications across NHS organisations to create a network of 1,000 caremakers by April 2014. Caremakers are nurses, midwives, allied health professionals and healthcare assistants who act as ambassadors for the 6 Cs. They are selected for demonstrating a commitment to spreading the word about compassion in practice across the NHS. The Caremaker programme aims to increase the spread of compassion in practice across the NHS and embed the values and behaviours set out in the 6 Cs to transform NHS culture.
It's about connecting people together across the NHS, sharing good practice and organisational development, and building OD capability so that ultimately patients are served with skill and compassion. This year we started to build that community through OD networks, online and in person. And we held the first ever OD conference in the summer that brought together 175 people from 123 organisations. We're about to embark on the next challenge, delivering 7 big OD projects in collaboration with our friends at the Leadership Academy, working with a group of keen OD professionals from across the NHS. And the most exciting thing about this work is that we've only just begun.
We held regional workshops to explain Home Office changes to the UK immigration system. Our team produced quick guides explaining the Tier 2 recruitment process. Coming next, we'll continue to provide ongoing expert advice and guidance on employment responsibilities around ethical international recruitment and managed migration. And we'll continue to work in partnership with key stakeholders to ensure employers' views are represented in the development of immigration policy and processes.
In May last year, we held a whistleblowing summit which led to 30 representatives from regulatory bodies, professional regulators, health unions and professional associations signing up to the Speaking Up Charter.
The Charter reflected a shared commitment from those organisations signed up to it in addressing the issues which prevent staff from reporting patient safety or other such concerns in the public interest. This year we're very much focused on producing guidance and tools which further assist employers in the internal communications and engagement with staff.
Last year we achieved flu vaccination uptake in frontline healthcare workers of 45.9%, the highest ever level of uptake for flu vaccination among NHS staff. We've increased the level of engagement with Trust Flu Leads through national support workshops and the Flu Fighter hotline. We have hosted the Flu Fighter Awards, celebrating the achievements of NHS trusts in increasing the uptake of the flu vaccination among frontline staff. This year, we will support lower achieving organisations to reach their target uptake. We will continue to improve engagement with staff side representation in support of the flu vaccination campaign.
Over the last year, we successfully concluded negotiations in the NHS Staff Council on revisions to the National Agenda for Change agreement that will allow employers to make stronger links between individual performance and incremental progression. We've also made changes to sick pay calculations. We submitted strong evidence to the pay review bodies that reflected employer concerns about the affordability of the NHS pay bill and the need for continued pay restraint to ensure continuation of high quality services and maintain jobs. We're providing advice and support for local employers to implement the new Agenda for Change pay flexibilities.
Last year, 10 ambassador trusts committed to doing more to embed the PFD vision into their workplace. We gained more than 100 new PFD champions from the Unison Conference and RCN Congress, bringing the total number of champions to nearly 4,000. We coordinated and developed the second NHS Equality, Diversity and Human Rights Week. Next year, we'll profile our CEO ambassadors and share their journeys, grow the PFD brand among health and social care organisations.
We introduced the new injury benefits provisions and supported employers with guidance on their application. We helped ensure that employers were aware of their responsibilities in respect of pensions automatic enrolment and developed tools and information to enable them to meet their compliance duties. We established the tripartite review with DH, NHS employers and trade unions to consider the impact of a raised pension age on staff, employers and patients. This year, we will respond to the final consultation relating to increased employee contributions, provide access to a consultancy service to provide additional support for employers through a tailored action plan to implement automatic enrolment, conclude the initial phase of the Working Longer review and present our findings and recommendations to DH.
The NHS Employers 2013 Summit brings together senior HR leaders to examine the changing role of HR within the NHS and explore how we can develop our future. We hope our 2013 Summit will give you updates on the latest thinking, practical solutions to strategic challenges. Have a great day.